My name is Darla Berry. I'm a certified nurse midwife, and I have been providing women's health services here at Putnam County for 3 years. I've been a nurse midwife for over 25 years. So a certified nurse midwife is a registered nurse with a baccalaureate or a 4-year degree in nursing, and then an additional 2 years typically either with a master's degree or a doctoral degree in midwifery or nursing. We do prenatal care. We provide women's health services across the lifespan. We follow the same standards and recommendations that OBGYN physicians do. So you're not going to get anything really wild and wacky and outside the normal recommended screenings. We look for the same complications in pregnancy. We do basically the same visits. However, the biggest difference is we are very relational in our caregiving. We are nurses at heart, so we come with a little bit more holistic perspective on pregnancy and how that integrates. It's not just you and your pregnant belly, it's how that integrates and impacts your life. Someone who's pregnant should never ignore a headache that doesn't resolve with normal means, that is Tylenol, rest, increased hydration. They should never ignore a headache that comes with blurry vision or nausea, vomiting. They should never ignore severe abdominal pain or cramping. A decrease in fetal movement once they've started feeling baby move is important to pay attention to, as is any kind of unexpected or unexplained bleeding. We've had a lot of attention recently, which is a good thing about postpartum depression. Baby blues are not uncommon. Baby blues, I tend to liken that to mood swings, crying spells that really are very fleeting. They come and go. But anything that comes and stays and keeps you or keeps a woman from performing their normal activities, so keeps them from eating, keeps them from sleeping, keeps them from taking care of their baby, keeps them from doing things that are normally expected behaviors. Anything that comes, it's like a dark cloud that comes and settles. That would be out of the ordinary and more towards postpartum depression as opposed to postpartum blues. I think it's important for women to allow themselves time to recuperate after having had a baby without the expectation that they are going to jump right back into the normal demands and expectations of daily life. I think postpartum care is every bit as important as prenatal care, even though kind of to this point we've probably not engaged in behaviors and actions that would indicate that we believe that's to be true. Typically, once you've had the baby, we then say, okay, you did a great job, we discharge you from the hospital and we'll see you in 6 weeks. Well, all of a sudden, we double the number of patients. We don't have just mom with the baby inside, we have mom and the baby. And we have a baby that can't communicate in any means other than crying, a baby that has never consumed food, milk, nutrition, independently, and we've interrupted mom's sleep. So a typical prenatal visit with a midwife includes the same things that a prenatal visit with an OBGYN physician includes. So that is kind of you come in and unfortunately you get a weight, you get blood pressure, vital signs. We talk about issues related to the pregnancy, whether or not baby is moving, whether they're feeling any kind of cramping or belly pain, whether there's any kind of discharge or leakage of fluid, anything unexpected physically is related to the pregnancy. I also typically talk about diet and how things are going at home and how things are going at work and how things just in terms of activity and acclimation and adjustment to pregnancy, how things are going, how mom's mood is. We do an assessment for depression several times during a pregnancy. And then we always measure the uterus to ensure that baby is growing, and we listen to heart tones. I think partners are critical for supporting their partners during pregnancy, because pregnancy, while we consider it to be normal, is taxing, and it really does take a toll on a person's body. So anything that they can do to help lighten that load, be open to conversation, try to have a thicker skin perhaps than usual, and know that most of the time it's hormones talking, it's not true feelings, but just being there and being present and being in that moment is really, really important. In the postpartum period, I think that we have a misconception and we have a tendency as helpers and as support people to say, here, let me take care of the baby for you. Well, really, ideally, what needs to happen is mom needs to take care of the baby and then all of the extra things around mom. Meal preparation, laundry, house cleaning, food securing and preparing. Those are the things that mom needs help with.